So I'll be sharing the screen now. So we are going to discuss about the renal threshold is already done now. We'll be discussing about the regulation of blood glucose. So this is something which we were discussing yesterday, the regulation of blood glucose. Okay, so what happens when the sugar level in your blood goes down, and what happens when your sugar level in the blood goes up? The body itself has got its own mechanism as to how to coordinate and bring the sugar level to normal. This is we had discussed, like, whenever the blood glucose falls below, the pancreas comes into action. Pancreas help to release glucagon from the alpha cells, and the liver releases the glucose into the blood, and the sugar level is maintained to the normal level. Whenever you have a high blood glucose level, what happens? The pancreas, from the beta cells of pancreas, insulin is released, and then it actually activates certain metabolic pathways which uses up the glucose, so that the glucose level is brought back to normal. So this is what is called as homeostasis, glucose homeostasis, which means you're maintaining a normal level of glucose. Now, if you see the right side diagram, this is very interesting. You can see the pancreas and the liver. They both are two different organs, but they actually communicate between each other. And depending upon what is the need of the cell, they both take their action. Okay. So when you have a high blood sugar, the peach color block, you can see whenever you have a high blood sugar, what happens? You follow the red arrow. The pancreas secretes insulin. And what does insulin do? It stimulates glucose uptake from the blood, and then it is transferred to the liver where glycolysis takes place, and it lowers the blood sugar. Now, if you see the green one, okay, what is happening whenever you have a low blood sugar, the bottom part? Whenever there is a low blood sugar, the green arrow you follow, the pancreas secretes glucagon. And what does glucagon do? It activates the glycogenolysis. Glycogenolysis is nothing but it stimulates the breakdown of glycogen, and glucose is released, and then there is an elevation in the glucose. So this is how it is actually regulated. So this diagram is very important. So please learn this diagram. Okay. Now, regulation of blood glucose is largely done through the endocrine hormones of the pancreas, which is a beautiful balance of hormones achieved through a negative feedback loop. Now, negative feedback loop is something which you have learned in your enzymology paper, where whenever a product is actually accumulating, the product itself goes and binds to specific enzymes, and then that enzyme gets blocked, so that further formation of that product is blocked. So that is what happens in the regulation of glucose also. So there are certain products, like it actually controls the metabolic pathways by maybe allosteric enzyme. Mostly it is regulated by allosteric enzyme, allosteric regulation. The main hormones of the pancreas that affect blood glucose include. So till recently we were already familiar with insulin, but there are of course other hormones also which has got a role in the regulation of blood glucose. So they are glucagon, somatostatin, and amylin. So these are the other hormones which have a role to play in the regulation of blood glucose. Okay. So insulin, we know it is formed from the beta cells of pancreas. It lowers the blood glucose level, while glucagon, so it is released from the alpha cells of pancreas. What does it do? It actually elevates the blood glucose level. So they both are having opposite action. Insulin brings down the glucose level. Glucagon brings up the glucose level. Now, there is yet another hormone which is called as a somatostatin. What does it do? Okay. So somatostatin is formed in the delta cells of the pancreas. So we were discussing about alpha cell, beta cell, and now about the delta, just like your virus names only. Okay, here you have inside the pancreas, you have different categories of cells. This is the delta cell of the pancreas, and it acts as a pancreatic policeman. So what does it do? Usually, what do your traffic police do? Traffic police actually directs, okay, now, okay, you people can come this side, and it stops the flow of traffic from another direction. Okay. Same way here also, there is a hormone, like, whether insulin is having one role, glucagon is having just the opposite role. So there should be somebody to control their opposite roles, right? So that is what is the role of somatostatin. So it is also called as a pancreatic policeman, which balances the insulin and glucagon. Now, what does it do? It helps the pancreas alternate in turning on and turning off each opposing hormone. So that actually regulates by switching on one hormone and switching off the next hormone, so that a beautiful coordinated regulation of blood glucose actually take place. Now, what happens as a meal containing carbohydrates is eaten and digested? So whenever you eat a meal which contains a lot of carbohydrates, just like your afternoon lunch which you're going to have, usually it is rich with carbohydrates, because either you will be eating a rice, or you'll be eating chapati, or you will be eating some usually idli dosa you don't eat in the lunch, or maybe biryani or fried rice or whatever that. I know now people are getting hungry. Okay, so these are rich in carbohydrates. So what happens immediately after your lunch? This carbohydrate breaks down into glucose and your blood glucose level rises. And the pancreas then immediately it will turn on the insulin production. So the blood inside your pancreas senses, okay, this fellow has eaten the food, and then there is a lot of carbohydrate which is breaking down to glucose and coming to my body. So that has to be, some action has to be taken. So what happens? Pancreas turns on the insulin production and turns off glucagon production. So what glucagon again is, what is glucagon's role? It is actually releasing glucose into the blood. So already you have eaten carbohydrate rich food, and there is a lot of glucose rushing into your blood. Again, glucagon's role is not required there. So glucagon will be switched off. Okay. So glucose from the bloodstream enters the liver cells. So once it is broken down, liver is a place where most of the catabolism takes place, where the glycolysis takes place. So stimulating the action of several enzymes that convert the glucose to chains of glycogen. So once the glucose has been converted to pyruvate, and when you have enough energy, then in the liver, the excess glucose which you have eaten is converted to glycogen. Okay, so long as both insulin and glucose remain plentiful. So as long as you are going on eating no sugar, you have a lot of sugar in your blood, so that you already have enough energy which has gone to the electron transport chain for the production of energy. You still have a lot of glucose molecules inside your blood, then it is converted to glycogen for future use. Like you store, when you have a lot of money, you put it in the bank so that you can retrieve it when you don't have money. Same way, the bank is the glycogen. Okay, so the storage form of glucose is glycogen. So whenever you're fasting, or whenever you have to skip meals when you're very busy or things like that, the glycogen is broken down to glucose. So in this postprandial or fed state, okay, postprandial is nothing but the fed state. Fed state means immediately after your food, the liver takes in more glucose from the blood than it releases. So releasing glucose takes place by glycogenolysis, when glycogen breaks down and releases glucose. So this, 1 minute. So glycogen breaks down and releases glucose. So this happens when you don't have enough glucose in your body. So after a meal has been digested, the blood glucose level begins to fall, and then insulin secretion also drops. So insulin's role is over. So immediately after your lunch only, the blood glucose level rises. So now insulin's role is over, and glycogen synthesis is also over. So when it is needed for energy, what happens? So by the time evening, okay, you have had lunch by 1 o'clock, and then by 4 o'clock or something, you still started, you still feel hungry. Then what does the liver do? The liver will go for glycogenolysis, where, glucagon hormone is activated. So the liver breaks down glycogen with the activation by glucagon and converts it into glucose for easy transport through the bloodstream to the cells of the body. So this is how the blood glucose is regulated. So depending upon what your cell requires, the body itself understands it, and the different hormone, insulin and glucagon, identify the situation inside your body, inside the blood, what is the level of the glucose, accordingly it acts. So in a healthy liver, up to 10% of the total volume is used for glycogen stores. Okay, so if you take the liver, 10% of your liver is just devoted for storing your glycogen. Okay, and the skeletal muscle. Okay, we also know that glycogen is stored in liver as well as in muscle. Okay, so in muscle also a part of glycogen is stored, that that comprises only 1%. And the liver converts glycogen back to glucose when it is needed for energy and regulates the amount of glucose circulating between meals. So liver is the one which actually converts the glycogen to glucose when it requires energy, and thus it regulates the amount of glucose circulating between meals. So between meals means what? After your meals, after 2 hours, you are still hungry. So that time, if the blood glucose level falls down, glucagon comes into action and breaks down from the glycogen and releases the glucose. So what does the insulin do? So this is a summary of whatever we have discussed now. The cells always need glucose for energy, okay? So however, most of them are unable to use glucose without the help of insulin. You have had a rich carbohydrate meal, but if you don't have insulin inside your body, the insulin only helps to give you energy. Okay, you would have had food, but still you don't feel energy. That is why diabetic people feel very tired, because though they have food, the insulin has to activate the process of glycolysis so that glucose is converted to pyruvate and energy is released. So that does not happen if insulin is not there. Okay. This is because insulin binds to a receptor, and when it binds to a receptor, it actually opens certain gates inside the cell. So the glucose enters inside the cell and glycolysis takes place. So understand? So it is actually a cascade of reaction which actually leads to the formation of energy. So if insulin is absent or insulin's receptor itself is not working properly, there could be many reasons why your glucose level is not coming down. Okay. So insulin gives glucose access to the cells. Understand? So when insulin is coming and binding to the receptor, only then the gate is open. Okay. Like when you are going to a place, when you have an access card, you actually show the access card and you enter inside the office. Okay. Same way here also, the insulin has to come and bind to the receptor. Once insulin binds to the receptor, only the gate opens and glucose can enter inside the cell so that glycolysis can take place. So when you're during your free time, you can watch YouTube videos on this. You understand things so much better, and you actually you will be at awe at the nature's beauty of how beautifully all these mechanisms takes place inside your body. Okay, so it attaches to the insulin receptors on cells throughout the body, instructing the cells to open and grant entry to glucose. Okay. So low levels of insulin constantly circulate through the body. So without your knowledge also, there is a very low level of insulin which is circulating inside your body so that it senses, okay, this fellow has had a rich a carbohydrate diet. So it is time for me to work. So it is always, I like a security guard going around the community. This insulin is always there in the blood. A spike in insulin signals to the liver that blood glucose is also high. Okay, so the security guard, as he sees something, he immediately whistles or he gives the message. Same way, whenever there is a lot of carbohydrate in the blood, immediately the insulin goes up. So immediately liver senses, okay, there is a increase in the level of insulin, which means the blood glucose is high. Now liver has to start working. How? By glycolysis. Okay, the process of glycolysis has to take place. The liver absorbs glucose, then changes it into a storage molecule called glycogen. Okay, so we know that this is what is called as glycogenesis, synthesis of glycogen. When blood glucose level drops, what happens? Glucagon instructs the liver to convert the glycogen back to glucose, causing blood sugar level to return to normal. So another important function of insulin. All these years, we would have known about insulin's job is only to decrease the blood glucose. Okay. Other than that, it has got yet another function that it supports healing after an injury. So whenever there is an injury, insulin actually supports a healing. How? By delivering amino acids to the muscles. So to the muscles, insulin delivers the amino acids so that healing takes place much faster. Okay. And amino acids, are helped to build a protein. A protein is comprising of different molecules of amino acid that is present in the muscle. So when insulin levels fall down, the muscle may not heal properly. Okay, so for healing process to be faster also, you should have insulin. This is the reason why when you are highly diabetic, your healing process also decreases. So this is yet another reason for that. Now, how does glucagon work? The liver stores glucose to power the cells during periods of low blood sugar. So whenever you have low blood sugar, the liver does this particular work. So skipping meals and poor nutrition can lower the blood sugar. So whenever you try to skip meals, so that is what usually happens for students that I have seen. No, you might be very busy. Either you will be busy. No, you will give less priority to your food only. Maybe once or twice only a day you might have meal. So please don't do that. Skipping meals and poor nutrition can lower blood sugar. By storing glucose, the liver makes sure that blood glucose level remains steady between meals and during sleep. So this is the reason why glucose is converted to glycogen and stored. So whenever you have such issues, whenever you are skipping meals or during the night when you're sleeping, there are so many hours of fasting stage where this process is taking place without your knowledge. Okay, so glycogen is converted to glucose. Similarly, when blood glucose falls, cells in the pancreas secrete glucagon in order to increase the glucose level. So glucagon instructs the liver to convert glycogen to glucose. So in ulta only takes place with the case of insulin. So in glucagon, when it comes, it makes glucose more available in the bloodstream. And from there, insulin attaches it to the receptors. So once the glucagon helps in producing the glucose in the blood, when that level goes up, insulin action takes place, and it measures to ensure that they absorb glucose, and thus we now understand that insulin and glucagon work in a cycle. So glucagon interacts with the liver to increase the blood sugar, while insulin reduces the blood sugar by helping the cells use glucose. So this is the summary of what really happens, the last line. Okay. So that finishes, the whatever we have done. We also discussed about what is meant by the normal blood sugar level. We discussed about what is meant by about the renal threshold, and about the regulation of blood glucose by insulin and glucagon. Now we go to the next session, which is what is called as hypoglycemia and hyperglycemia. Okay. Yeah. So this is something related to the regulation of blood glucose. Okay. Hypoglycemia and hyperglycemia. Now the term itself explains hypo means less. Something related with glyce means it is about the sugar content. Emia means blood. Okay. So hypoglycemia means less amount of sugar in the blood. Okay. So hypoglycemia is characterized by a reduction in plasma glucose concentration to a level that may induce symptoms or signs such as altered mental status and or sympathetic nervous system stimulation. Okay. So hypoglycemia is a condition where you have less amount of glucose in your body. And what is a symptom of that? Okay, you usually feel very dizzy. You would have experienced it when you skip meal for a long time, or if you haven't had food for a long time. No, and if you have a very heavy exercise, you have gone for a walk, or you've gone for a running race or something like that without food, you must have experienced this. Okay, you feel dizzy, and you cannot understand what the other person is speaking and things like that. That is what is called as even your nervous system stimulation is broken down. So this condition typically arises from abnormalities in the mechanisms involved in glucose homeostasis. So glucose homeostasis is what we just now discussed. So if any question is asked about what is, write an essay on glucose homeostasis, don't say that it was not taught. Okay, glucose homeostasis is nothing but the regulation of blood glucose. So the most common cause of hypoglycemia in patients with diabetes. Okay, so this hypoglycemia, it is not like something like hyperglycemia. You would have heard about hyperglycemia, but hypoglycemia is more fatal. Okay, why? Because glucose is the energy source for the brain, and if glucose is not enough to supply to the brain, what happens? You will lose your cognitive ability and you feel dizzy, and it can lead to coma if your glucose level falls very drastically to a very low level. Okay, so the most common cause of hypoglycemia in patients with diabetes. So usually this happens to a diabetic patient. Why? Because is injecting a shot of insulin and skipping a meal or overdosing insulin. Now this is, you must be familiar with somebody in your family who is diabetic or who might be taking insulin. Okay. So remember that always doctor tells to take insulin injection before the food. And then what happens? Somebody calls, somebody rings a bell, and this person goes, attends to them, talk to them, and comes back. And then it is almost 1 hour. Then he has the food. What happens during this time? The insulin has gone into the body. What is insulin's role? To bring down the glucose level. Did you eat food to bring down the glucose level? No, you went out and you were chatting with the person, right? So you didn't have enough glucose to bring down the glucose level. Whatever existing glucose level, only insulin will start acting, and then this leads to hypoglycemia. Okay. So this thing, it should be very clear that whenever you're taking an insulin shot, immediately food has to be taken. Okay, and insulin dosage. So the doctors might give the dose, for example, this many millimoles has to be taken. And usually you have seen that insulin syringe is a very small syringe. You'll have to keep it in near the sunlight and see the actual graduation. When you are doubling that, maybe okay, oh, this much only, 1 drop only, okay, it's okay. No, even 1 drop can make a lot of difference. Okay, when you would have done your enzymology practically, you would have noticed. If you're not pipetting properly, you don't get the correct values, right? So even 1 drop can make a lot of difference. Okay, so when you're injecting or overdosing with insulin, it also this hypoglycemia can occur. So generally, hypoglycemia is defined as a serum glucose level, the amount of sugar or glucose in your blood below 70 milligram per deciliter. So last class we were discussing about what is a normal sugar level. Normal sugar level, we discussed it is about between 90 to 110. So that if it is falling below 70, whether it is fasting or after food also, if your blood sugar level is falling below 70 milligram per deciliter, you call that, you say that you are hypoglycemic. What are the symptoms of non-diabetic hypoglycemia? So what are the symptoms you might have experienced or not, you don't know. So symptoms of hypoglycemia typically appear at levels below 60 milligram per deciliter. So though you are hypoglycemic, you might not feel that you are hypoglycemic. Okay, so there are many people who are actually hypoglycemic, but they are not realizing they are hypoglycemic. So this you will be experiencing it only if it comes below 60 milligram per deciliter, and levels below 50 milligram per deciliter affects the brain function. So you have to be very careful. So those who have been identified to be hypoglycemic, it is better to carry some chocolates with you. So whenever you feel a little dizzy or things like that, pop in a chocolate and eat. The sugar level immediately will come to your brain and you will feel a little energetic. And the body regulates its glucose level, the primary source of energy for what all brain, muscle, and other essential cells by the action of different hormones. Okay, so just now we discussed about the role of insulin, glucagon, somatostatin in regulating the blood glucose level. So which are these? Okay, insulin, which lowers the blood sugar level, and other chemicals which raise blood sugar. So other than this insulin and glucagon, there are other hormones also, like such as glucagon, growth hormone, epinephrine. So these are other hormones which are having a role in homeostasis of glucose. Okay. So epinephrine or your glucocorticoid hormone, that is the reason why sometimes when you're overstressed also for a long time, you might have hyperglycemia. Okay, because these are hormones which increases the blood sugar level. Unlike insulin, insulin actually reduces the blood sugar level, while glucagon, growth hormone, and epinephrine actually increases the blood sugar level. Now, both insulin and glucagon are manufactured in the pancreas. And pancreas is an organ near the stomach, which helps in the digestive tract. So digestive tract, what is its role? It usually produces the pancreatic amylase, okay, which helps in digestion. And other than that, so though the organ pancreas is a very small organ, it has got very important role to play in digestion as well as in glucose regulation of the body. Okay, so special cells in the pancreas, just now we discussed about the alpha cell, beta cells, and the delta cells. Okay, so beta cells secrete insulin, alpha cells in the pancreas secrete glucagon, and delta cells secrete somatostatin. What is the other name for somatostatin? Anybody remembers a common name for somatostatin? Nobody? Are you all there, or did you all go to the kitchen to have lunch?
Ma'am, growth hormone.
Okay. No, somatostatin. Somatostatin is like the policeman, right? So it is actually controlling the glucagon and epinephrine. So the role of insulin is to help in the absorption of glucose from the blood by causing it to be stored in the liver or to be transported into other tissues of the body. Okay. So glucagon increases the amount of glucose in the blood by breaking down the stored glucose, which is starch or glycogen, and it releases into the liver, into the bloodstream. And insulin and glucagon are usually correctly balanced if the liver and pancreas are functioning normally. So under normal condition, everything goes very fine. Okay, till when you realize that there is something wrong. So otherwise, but to about 40-50 years and all, things and all goes very smoothly. Now coming to role of epinephrine in regulation of glucose. Okay, traditionally it is considered as a stress hormone. Epinephrine. It is called as a flight hormone. Whenever you are scared, suppose you are asked to come and stand in front of the stage and speak something suddenly, that you get a high release of epinephrine, you get tense and you start shivering, things like that. Okay, but this also happens when you're stressed out. Okay, so when you're stressed, also there's a lot of release of epinephrine. So continuously, if you're stressed out, what happens? This epinephrine is having a negative role to play, unlike insulin. Insulin brings down glucose, glucagon, epinephrine, growth hormone, corticosteroid hormones. These are the hormones which has got negative effect of insulin, which means it brings up the glucose. So continuously for 2 years together, you have a very stressful life and things like that. You are prone to be diabetic because your glucose level can increase. Okay. So epinephrine also elevates blood glucose levels by making glucose available in the body during a time of stress. So this is the biochemical reason which says that stress can cause diabetes. Okay, so you should be able to explain why. Okay, because if during stress, epinephrine hormone is released. Epinephrine hormone's role is in increasing the amount of glucose in the blood. So what does it do? It will activate glycogenolysis, where glycogen is broken down to glucose. Okay. It will inhibit glycolysis. Inhibit glycolysis means what? Glucose cannot be broken down. So all this can lead to an increase in glucose. It can activate gluconeogenesis, means synthesis of glucose from other molecules. So other hormones also help in raising the level of blood glucose level. Which are the other hormones? They are cortisol made by adrenal gland and growth hormone made by the pituitary gland. Okay. So other hormones are corticosteroid hormones or cortisol and growth hormone. Okay. So this is the reason why during the second wave of corona, steroid hormones were administered as drugs. Okay. Because for very complications, steroid actually works very fast to bring down disorders. But steroid has another effect, is that steroid can has the opposite effect of insulin, which actually promotes the formation of glucose in your blood, and it can cause hypoglycemia. So whoever is treated with the steroid hormone or steroid injections are administered or steroid tablets are administered, doctors always monitor their blood glucose level. 1 week they will give one dosage. If they are increasing the dosage in the next week again they will ask you to go for a blood test. Okay, just to monitor your blood glucose level. And usually people tend to have increased their blood glucose level, so they will be administered with tablets which reduces the glucose level. So if you are administered with steroid only for maybe 2 weeks or 3 weeks, after taking tablets for 2 to 3 weeks to reduce your blood glucose level, it becomes perfect. So that's the reason why they say that you should not depend on certain, I'm not blaming other type of medicine like, certain maybe homeo or Ayurveda or some powder like medicine. If anybody gives, please don't blindly believe them. Okay, there are cases where no use there's certain some doctors, not the actual doctors, certified doctors, they give some medicines in powders and packets and things like that. But people take it and they get relieved of certain diseases very fast. Once this happened to my father, okay, because my father is allergic, so no, so there was one homeo medicine or something, which no, which was giving instant cure for so many people, and then they had suggested, and daddy had taken that. And our family doctor, he saw my daddy after 1 month, and he said, "There's something wrong with you." We see him every day. We didn't understand that. So then he said, "You do one thing. You give me a blood test. I will, no, I will check it out." And he checked, and his glucose level had risen, shot up so much. Okay, he said, "Stop your the medicine, taper it and stop. I think it contains steroid." So this powder was sent for analysis, and then steroid was identified in that. Okay, lucky that our family doctor identified that there's something wrong. Okay, so these are the problems with many other medicines when you take from other doctors who are not certified. These things can happen. So what is the moral of the story we are talking about? The steroid hormones and other corticosteroid hormones and growth hormones can also cause an increase in the blood glucose level. Okay, so now coming to hypoglycemia causes. What are the causes of hypoglycemia? So over medication with insulin or anti-diabetic pills, okay? So that can also cause hypoglycemia. So this is the reason why they say that don't take medicine by your own prescription. I've seen certain people know that they would have gone to the doctor for diabetes. The doctor would have prescribed the medicine. They'll be continuously taking the medicine. They'll be trying out some Ayurveda or other medicine also, which can bring down your glucose level. Along with that, they would have changed their lifestyle also. Okay, they were going for exercise and things like that. What happens? Suddenly the glucose level will fall down. So blindly don't take even prescribed medicine for more than 6 months. Please go and see your doctor if doctor has told you. Okay, because then maybe we will have to do your blood test once again and check whether your blood glucose level has come down, which means your dosage should be reduced. If it is not reduced again, that can cause hypoglycemia. Okay, then use of medication such as beta blockers, pentamidine, sulfamethoxyl, and trimethoprim, Bactrim, etc., the usual name which we call them. So all these medicines, then use of alcohols. Then if you have missed meals, okay, these are all reasons why you can become hypoglycemic. Now, reactive hypoglycemia is a result of delayed insulin release after a meal has been absorbed and occurs 4 to 6 hours after eating. So this is certain people might have reactive hypoglycemia. Then certain severe infection can also cause it, and cancer causing poor oral intake or cancer involving the liver, because when a patient is having a cancer and oral intake of food is not taken properly, then that also could lead to hypoglycemia. Now, other hypoglycemia causes are adrenal insufficiency, means your adrenal gland is not able to secrete the adrenaline, which can help in increasing the glucose level. Okay, so that is why we are telling that now endocrinology is a very fast developing field where you are understanding that the role of hormones in the cause of many diseases. So remember, we are in hypoglycemia causes. In the next class, please remember. Okay. Yeah. Now, dear students,